Good morning, everyone. Welcome to day 2 of Affordable Housing Week. My name is Danny Turk, and I am the Membership Programs and Equity Manager for the Housing Development Consortium. I'll be the moderator for this session. I'm also the Affinity Group convener, and I'm really excited to introduce you to this session, which is Resident Services Navigating Challenging New Landscapes. And before we get going, I have in the chat, I'm going to be sending in the chat the Affordable Housing Week link for those of you who are interested in attending some other sessions this week. They should be great. And I wanted to give a big shout out to our sponsors. Thank you so much for your support. So before we get going, I thought it would be really helpful to ensure that folks were really clear about what the resident service coordinator role is, what the resident services affinity group is, and how we got ourselves here today, the context and context setting for that. So the resident services coordinator role operates in housing authorities and other affordable housing programs. They play a critical role in connecting residents to support services and resources that can really help stabilize residents in housing and really helps improve or can help improve the quality of the lives of the residents in affordable housing. And the Resident Services Affinity Group is intended to convene affordable housing resident service coordinators and other providers who are supportive of the role to help collaborate, to help nurture partnerships, to help share resources with the goal of enriching the lives of residents in affordable housing. The Affinity Group works to develop, refine, and advocate best practices that promote sustainable, cost-effective outcomes. So as a convener with or for the Resident Services Affinity Group with the chair, Khadija Abdullah, and many of the others that are on this call today, you're going to be hearing about the emerging trends, the challenges, and the needs to promote resiliency and well-being among the residents and the resident service staff. A little bit of context setting. HDC in January sponsored 2 trainings, January and February, or January and March. One was a suicide prevention and an intervention training, and the other was de-escalation and personal safety through a trauma-informed lens. And it was in debriefing those conversations that we received a lot of feedback from the Resident Services Affinity Group members across about 8 different organizations about their needs and their challenges. And we learned that day-to-day, essentially day-to-day is just unsustainable. The day-to-day kind of grind of resident services is unsustainable. We feel that we're in an inflection point where resident service or resident crises, including deaths, are rising at unprecedented rates. And these unrelenting acute needs are coming at the cost of staff well-being. So as we did these deep dives, in these conversations, we decided to solicit really specific feedback from the resident service staff. We have probably upwards of 80 people who attend off and on these meetings. And so we did receive pages of feedback from the resident service staff. And I wanted to highlight a few of those high priority items that will drive the conversation today among the panel. So some of these include the concerns of not having a livable wage, resident service coordinators experiencing high levels of secondary trauma, the experience of losing staff So high staff turnover and losing teammates, excessively high caseloads, resident service staff being ill-equipped to meet the needs of the residents. And this includes the need for safety protocols, added on-site security, resources and trauma-informed training, and crisis management support, to name a few. Resident service coordinators identified not necessarily having the support of upper management for those that aren't regularly interfacing with residents, by comparison to folks who are boots on the ground and seeing things day to day and in the thick of it. And property management challenges. Those are just a few of many concerns that have risen in this post-COVID, and I'll say that in air quotes, post-COVID time, and since the murder of George Floyd and all the changes that we've been experiencing in the last few years. So with that said, I am really excited to be able to introduce the panelists who are members of the Resident Services Affinity Group. As I mentioned earlier, we have this group being hosted by Resident Services Affinity Group. So I'd like to turn this over to my colleagues. I want to thank you all for being here. If you could introduce yourselves, your name, your pronouns, your organization, whether your organization receives HUD funding, and your role, if I didn't mention that, and how the resident services role is being used in your organization. And I'll invite Bunthay to start us off. Bunthay, welcome.
Thank you, Danny, and good to see everybody here. My name is Bunthay Cheam, he, him pronouns. I'm the Senior Program Manager for Resident Services at Mount Baker Housing Association. We have both tax credit and Section 8 folks living in our properties. And, you know, how do we use resident services, or how does resident services work? We really rely on our residents, really, and that's kind of the basis of how we operate. They're centered in everything we do because it's what they communicate to us, is the way we build our program. And so, yeah, resident services really build off of serving residents based on what they communicate to us.
Thank you, Bunthay. I'd like to welcome Kellie Rogers. Kellie, would you introduce yourself?
Good morning, everyone. My name is Kellie Rogers, and I am the Resident Services Manager for CIRC. CIRC serves tax credit properties. We serve 3 or 4 different ownership groups at different levels. The way that our resident services programs work is that we support about 90% of our properties are senior properties. We have about 10% that are families, and we serve on-site direct resident services support. Thank you.
Thank you, Kellie. V. Lee, would you like to introduce yourself?
Good morning. My name is V. Lee, and I am the Associate Director of Resident Services at Mercy Housing Northwest. Mercy Housing is a non-profit organization nationally, but for the Northwest, we own and operate about 59 property throughout Washington and Idaho. So in Washington, we have property from Bellingham to Vancouver. And okay, and then for rest, we have seniors, family, and supportive housing throughout our Washington state and Idaho. And then for resident service team, we have resident service coordinator, case manager. We have youth initiative and school liaison who work directly with resident on site, either one-on-one or in a group work to support the resident on site. And we have funding for resident services through either public funding, private funding, or mainly through our fundraising.
Thank you, V. Natasha, would you like to introduce yourself?
Sure. Hi, good morning. My name is Natasha Al-Maly and I work for King County Housing Authority, which does get HUD funding. Many years ago, V and I co-chaired this affinity group together. Those were good times. We've been in this game quite a while, so I hope everyone enjoys our presentation today. We at KCHA, we work with seniors and mixed population and family sites all over King County. My team works specifically on the north and east side, so Shoreline, Bellevue, Kirkland, Woodinville, everywhere in between. Yeah, and so that's us.
Thanks, Natasha. Last but not least, Mary Pat.
Good morning, everyone. She, her pronouns, Mary Pat O'Leary. I'm a senior planner with the Area Agency on Aging that serves all of King County. I am a registered nurse and I work on health promotion initiatives, and it is delightful to be here today. And as Natasha said, I remember when she co-chaired this affinity group, and so I've been around a long time too with this amazing group of folks and learning some of the new folks that are on board. So happy to be here with you today.
Thank you so much, Mary Pat. Welcome to the panel. I'm going to start as your moderator with a few questions for the group. So starting with V, what would you say the value of the resident service coordinator is? And can you share a success story that highlights the need for the resident service coordinator work?
Resident service play an impact role in our organization that affecting residents directly. And in my speech, I will talk more about the impact to our residents. So at our organization, we resident services do programming and support the resident through our program model, which including housing stability, financial stability, health and wellness, out of school time, community engagement. So we have supporting residents in all the area. Because I have been fortunately to be with Mercy House for 12 years, I have seen a lot of progress or success story in our residents. I was able to see a resident that attended my homework club when I first started with Mercy. Now they go to college as a first generation of their family to go to college. That was a success. We were able to serve a lot of residents during the pandemic with food, not only any food, but food that tailor to their cultural need. Because we know that, especially in King County, we're serving very diversity of residents, and all residents eat the same food. So we were able to support food security among the residents. I was able to see an immigrant family able to pass their citizenship test and achieve their American dream by either open their own catering business or moving on with their own home that they're able to buy. So all the success of the resident they're able to do is related to the work that our resident service coordinator doing with them, either one-on-one, either they offer the group section, either they connect them with the resources that the resident need. So those are the success stories that I have seeing or recognizing during my 12 years at Mercy.
Wow, V, that's a long time. And those are some really significant success stories. Thank you.
Mm-hmm.
I'd like to invite Kellie. And just a reminder to the group that we've got folks on the call who aren't familiar with some of the work that we do, and to hold off on using acronyms whenever possible. Thank you so much. Okay, Kellie.
Thanks, Danny. So what I'm going to talk about is how resident services coordination can actually benefit the ownership group and the property management or funders and investors in the big communities. There's a couple of areas that, by the way, this comes from research that was done in 2017 through actually in a partnership with Mercy Housing. But one of the things that was discovered is that it lowers the premature apartment turnover rate because resident services coordination can access supports, especially for seniors, to allow them to age in place. They also RSC work, or sorry, resident services coordination work can reduce, shows a reduction in unit damages. And this is because we can bring resources in to support housekeeping, fall prevention, folks experiencing high clutter needs and need support around that. We also can lower the amount of operations staff's time in engaging with resident issues. So we can take a lot of stress off of the community manager or the property manager or assistant manager by being able to mitigate ongoing resident on resident issues or resident on against property management issues. We can also support lease violation mitigations by helping residents being able to come up with a plan to remediate whatever a lease violation they might have. And all of this will actually decrease the community management staff's stress, which can help support less turnover. Also, that research showed, and again, this was from 2017, so we feel like this number is very low compared to the numbers we would see today in 2023. But that research actually showed that properties that had resident services coordination involved after the cost of resident services coordination still saved $356 per unit per year. So if you have a community that has 100 apartments, that's $356,000 a year that resident services coordination saved the ownership groups for while having the resident services coordinators involved in running the community. So those were some of the things that I came up with. And I'm sure as we answer questions later, we will be able to highlight more things that we can do. Thank you.
Thank you, Kelly. It's really helpful to see some of those stats or to hear some of those stats, to have a real number and impact of the resident services coordinator position. Thank you. Bunthay.
Yeah, I think that for us, resident services serves as like the messengers for residents. And so that's a hugely critical role when we think about how to connect, the people we serve. And at Mount Baker Housing Association, we serve predominantly immigrant refugee communities. There's over 9 languages spoken across Southeast Asian languages, to East African, to Black, to Latinx folks. So how do you connect the community we serve to the leadership and the board that is predominantly white, right? And so again, like I said earlier, we're centered around our residents and what our residents communicate to us. We base our program on, and then some really cool things that have happened in the past couple of years is kind of in pursuit of that messaging. And so a really cool story that happened in the last year was a story of a playground at our Mount Baker Village site. In 2018, we finished like a remodel of Mount Baker Village, and unfortunately, there used to be a playground, and the playground got axed because we ran out of money. And so that playground has always been top of mind for us because we hear it all the time from residents. We need a play space. We used to have a play space. Where's the play space? And then a couple of years ago, we created a a youth internship program that was available to high school and college age youth that live at Mount Baker Housing Association properties, because we had heard this need for residents need to access what Mount Baker Housing Association is. And so what better way to get them closer to internally in our board, so on and so forth. And out of this past year's internship, there's two interns, both interns talked about the importance of play space, right? And made these really beautiful videos that I can share with folks after, if they're interested, about like just play space in general. And then one of the interns talked about themselves growing up and having this play space and the impact it had on the community. So fast forward, we to now, we had received funding to bring back a play space. And instead of like thinking, instead of doing things how we had done in the past around, getting resident input or bringing them along in the process of the remodel, we decided to kind of really center them. And so last year, one of our resident services coordinators, Sophia Sam, which is on the call here, and one of our teaching artists, contractors, partners, Dene Diaz, did a 5-session workshop on what a play space, what do you want out of a play space? And so they facilitated this workshop that they called the Young Dreamers Playground Project. And out of it came this really beautiful rendering of all the things that they would love to have in a play space. And so now we've taken kind of what they've created and put some things behind it. And so we're in the process of finding an architect, making sure we're surveying the rest of the community, so on and so forth. But the biggest difference is that we centered the residents, especially the youth, around what does it look like to have this thing, and kind of lean on y'all and center what y'all, so that we can build it meaningfully and not just assume things. And so I think that's one of the biggest success stories. I mean, it's ongoing right now, but at least we know that the roots of this project is in the youth, in the residents that we have. And then one other thing, just shifting to development side, because that's the biggest side of many of our organizations. Through this internship program, we've begun to kind of like tap into again residents' thoughts and ideas. And so resident services, again, as messengers of the residents, are now shifting into a lot of development meetings. And so this past week, myself and Khadija were knee deep in interviews with architects, interviews with developers for future properties. And the reason being is that, what's the best way to get input from the end users? And again, resident services coordinators are the messengers and are the access point to some of those things, so that we hold ourselves accountable to making sure we make these buildings that communities. And so, yeah, those are kind of examples of that I can think of how resident services can help an organization as a whole.
Thank you so much, Bunthay. Natasha, how about you?
Yeah, so as we know in the resident services world, giving someone a home is not typically enough to keep them stable, especially when they've come from living outside or just have a lot of high barriers. And I think resident services provides the support and guidance that some folks need to be able to stay stably housed. And by doing that, we're actually benefiting the entire community. It saves the taxpayers about $6,000 every time we prevent an eviction and have someone not out on the streets again. So it's, resident services benefits the whole community in that way. Also, I did want to also touch on how it benefits us, those who are here and those who are also interested in this work. I've been doing resident services in some form since 2005. And I've sort of just devoted my whole life to it at this point. I don't really think there's anything else that I would do, but I really enjoy this work, and I really think that it's beneficial to our community, and it makes me feel good. I can take care of my family doing this work. It is something that I look forward to doing. I see a lot of success stories. I think we've seen the homeless crisis grow out of control, and it is, it's really hard to watch, right? But through our work, we can feel like we are making some bit of an impact by keeping those that we work with housed.
Natasha, thank you so much. Mary Pat, so given your unique role as a public health nurse who has so much historical knowledge and wisdom on the development of the RSC role or the resident services coordinator role in this community, how would you respond to this question?
Thank you, Danny. Thank you, Danny. First, let me say it's been a privilege for me to be involved with the Resident Services Affinity Group. As you heard from the panelists, resident services coordinators provide residents, owners, funders, and the community incredible service. I personally attest that prior to and during the COVID-19 pandemic, resident service coordinators consistently demonstrated commitment and value to resident services. For example, Bellwether Housing was one of the original housing providers that agreed to participate in the senior drug education pilot that allows a pharmacist to work with low-income older adults, one-to-one, providing coaching, and also in group settings for medication issues, also timely topics about high blood pressure, fall prevention, and they also held flu clinics. Our housing providers have faced multiple challenges during the pandemic, including access to food, durable medical equipment, medications, and most importantly, the impacts of social isolation. During COVID-19, the resident service coordinators did welfare checks via telephone and provided connection to the outside world for many residents. They are and continue to be instrumental in housing stabilization. Thank you.
Thank you, Mary Pat. So for our next question to the panel, what are the challenges that the resident service coordinators are facing in their work today? Starting with V.
In the work today, we experience, and this is not only Mercy Housing, but by talking with other housing providers or other nonprofit organizations, we learned that we have been the same challenge, maintain or sustaining our staff at the site level. We are unable to have a lot of funding to increase the staff salary or wages so that we can keep the staff work nearby the workplace that they're supposed to go to. We have staff have to quit the job because they're unable to afford rent in Seattle. And because they work in Seattle, they have to be somewhere in Seattle. And with their current wages, they cannot afford even housing in King County. Or even childcare, because our work is a frontline staff. So since the pandemic, Mercy Housing resident service staff didn't work offline. We on-site and supporting our staff on-site every day since the pandemic started. So the staff have to pay for childcare, and the cost of childcare is also high. So that's why maintaining or sustaining staff at a regular rate is needed to be paying more attention. So I learned that from a research from UW. We with the skill set that our staff have, we now got paid less than other positions that they having in the community. Other than wages, we have also recognized there is a burnout and a lack of excitement since the pandemic. Staff is overworked from limited staff in every position and have a daily struggle to complete all the tasks at hand. So because resident service staff, like I said, have not been able to hold regular resident group in person because of the pandemic, and they felt the loss of close interaction with residents during activities. At Mercy Housing, we actively looking for opportunity funding to increase inner motivation and well-being among staff. There's a lot of funding to support residents directly, but there's not a lot of funding to support the frontline staff. Fortunately, we were able to pursue a grant in King County as an innovation grant. So that funding will help us in 1.5 years to access, test, and perform resident-focused support that combine behavioral health alongside complementary tool and practice for the frontline staff. So currently, our resident service team does not have any clinical behavioral health expertise on the staff. So with this funding, we would be able to partner with another provider, behavioral health provider, to have a staff that serve as a clinical service manager that serve both resident and the frontline staff. So this position, along with the site staff, will employ the basic principle of social worker. For example, like provide harm reduction training, motivational interviewing, any strength-based perspective in reaching out to both the staff and the resident to various model of focus group, training, or personal exploration activity. So we hope that with that funding, staff will feel more relaxed and happy and have decreased stress level to help them better perform their duty.
Thank you so much, V. That's quite a bit. Appreciate all of your input. Natasha.
So like I keep talking about, I've been doing this a while now, since 2005. I first worked at Everett Housing Authority as an AmeriCorps, and then Volunteers of America and Mercy Housing, and then now King County Housing Authority. And I've just noticed, I'm sure you all have, just a significant change in the work and the residents during that time. One of the main things is just the level of barriers that we're seeing now were not there before. Resident services started as referral, resource and referral type work. So if someone is having trouble paying rent, needs to go to the food bank and doesn't know how to get there, that sort of work, they come to us and we sit with them and we make sure that they have those resources and can do that. Now, because of just the barriers that are happening, the level of issues that we're getting because of the homelessness crisis and the pandemic too, it's instead of just going and meeting with someone, you might go to their door and they're screaming and asking you to leave, or that they're going to hurt you if you try to help them. So we have accepted more people into our housing program with high barriers, which is great. We want to serve those people. We don't want to see them living in encampments. We want them to be housed, but we haven't built the infrastructure to take care of them. We don't have the safety net of resources for them. And we also don't have the staff training for it. And that's where the burnout comes from. It's like, and that's why some people may be feeling like, is this really worth these low wages? I believe in the work, but can I do this every day and not be able to pay my bills? So more de-escalation training and more resources with crisis and commitment. That's when someone is beyond the help of what a resident services coordinator can do, we are in need of more. We are in need of more resources for them. There would be less burnout and more excitement for the work if there was something that could actually be done about someone who just is having a rough time, instead of it being entirely on the resident services coordinator to solve that person's problems. If they could get them to the hospital, get them in touch with family members, get them in touch with a mental health therapist. That would be helpful. So also trauma informed care, de-escalation training, safety training, taking care of yourself, knowing when to give up, when it's okay, okay, this is beyond the work that I can do. It's time to pass this off to a professional, to a team of professionals who know how to handle this situation. And then I can come back with my resources and referrals and help this person remain stably housed. Thank you.
Thank you so much, Natasha. Kellie.
I'm so glad I get to go after Natasha, because I kind of wanted to build on some of the things that she was speaking to. Through the survey results, we heard from a lot of service coordinators kind of about their thoughts and their feelings and their sense of inadequacy in a lot of ways in their attempts to do this work. And these are strong, talented, amazing individuals who are feeling really inadequate because of the level of barriers and expectations from the residents as to what they can provide. And resident services coordination originally was designed on this idea that there would be a person at the community who would know all the resources and be able to connect you to the resources. It wasn't based on the idea of kind of case management or intensive case management. And what's happening over time is that the needs of the residents are getting to the level where case management is more of an appropriate intervention than connection to a resident services coordinator, which then leaves folks feeling inadequate, like they weren't able to do their work. And so when we think about how to support our staff in doing this work, really, all of those things that Natasha spoke to around bringing in training, and also bringing in support training to help folks understand trauma-informed care, understand de-escalation skills and strategies, motivational interviewing, and all those kind of strategies that can help us engage and communicate with folks are really, really important. But also what's really important is that there are actual supportive services to connect those folks to. And that's kind of what Natasha was alluding to. Like, it isn't just that, we could do a really great job of connecting people to services if those services existed and were accessible, in the sense that there wasn't, a 2-year wait list to get somebody into them. And so all of those things combined are leaving our staff feeling like they aren't good enough and they don't have enough to offer, and it feels overwhelming. I think the other side of that is, and this came up a lot in the survey, the other side of that is that staff themselves are not feeling safe. They're not feeling safe on sites. They are often working in isolation, meaning that they're kind of in their community. We always teach to partner with your community management team, but often we're in different spaces in the community. So we're not, next to each other, or able to engage with each other, or even debrief with each other, because we're all kind of often doing our work in different places. And folks were talking about, they might be meeting with a resident who was experiencing substance use issues, and that person was really struggling. And those struggles started to feel personally directed towards the RSC. And the resident services coordinator doesn't have the skills to be able to de-escalate them, and also doesn't feel safe in extricating themselves from that situation. We had many folks talk about how they were afraid to walk to their cars at night in the dark. We've had staff say they don't know what to do when somebody's really escalated. Like, when do you call 911? When do when don't you, in particular in communities where contacting law enforcement is actually can be more harmful than good. And so all of these things are things that the RSCs are carrying with them. And then there's one last huge one that came up repeatedly, and that is the direct racism that is directed specifically towards our staff from residents, and that our staff, the folks that that we are supporting, are directing in really negative ways, you know, sort of racist micro and macro aggressions towards the folks that are there specifically to help them. And so walking through those communities every day, getting those, you know, those barbs and those racist comments and all of those things thrown at you, and then in being expected to maintain a professional level of support is asking a lot of our staff. And so we're really, if anyone has any really great ideas, we would love to hear them around how to support our staff in this, because we really, as leadership teams, looking for ways to do that. All right, I think, thank you.
Kellie, thank you so much. It's a lot and a lot of weight. I appreciate you reflecting the weight that resident service coordinator staff are experiencing, and particularly for staff, there are many more staff who are staff of color in these roles, and the impact of the racism they're experiencing day to day supporting residents, and the challenges of maintaining well-being in situations like that. Bunthay.
Yeah, yesterday I was I attended the kickoff for Affordable Housing Week, and there was a panel that included Dr. Catherine Cushenberry, CEO of Hope Lincoln. There was a part in the panel where she said something along the lines of people are struggling to live where they work, and just all about how can, you know, especially folks in resident service coordinator role be work in certain places but have to live so far away from where they work. And you know, that resonated a lot with me. Most of our properties are in, or yeah, most if not all our properties are in Seattle, just one in Skyway. And I think when I first started, resident services was kind of like an afterthought. The organization was so focused on like development, and it was just Khadijah and I, and very siloed, two people just doing their own thing, and just not having kind of the resources that we need to put together like a robust and meaningful program, especially for ourselves too. And so a couple of years ago, you know, the organization started to shift, and you know, all the things that everybody said here are things that Khadijah and I have kind of navigated on our own. And now that we've started to shift and kind of pull resident services in, it's done quite a lot around what does it mean to take care of your people, right? Because if you don't take if resident services aren't good, how do we take care of the residents that need our help? And so I think one of the most meaningful things we did in the last couple of years is put a floor for pay for anybody in our organization at $70K. So that I think helped a lot. Internally, we thought about what does it mean to bring the right type of capacity for resident services and to fund it the way it needs to be funded. And so out of that, we're able to hire 2 new resident services coordinators, and then a program assistant, because we were stretched so thin, right? And that has, we got 2 really great resident service coordinator and a program assistant, who I believe are on the calls here, Jawari and Lindsay and Kyla. And that's made a huge difference. And we wouldn't have been able to get that type of talent if we didn't have meaningful pay for that role. In this year, we've really begun taking a look at what does it mean to take care of our people so that our people can take care of the residents. And so we've dug a lot into what professional development is. What does it mean to build a bench? What does it mean to have time to reflect? What does it mean to check in with each other? And what does it mean to also build the resources that we that a lot of folks have talked about on this call? And we don't have all the answers yet, but a really cool training we have, training/retreat we have next month is a circle keep training. And so that workshop will serve as both a team building experience and also addressing things around what different ways can you address conflict, what different ways can you try to mitigate when there are disagreements, whether it's internally as a team or facilitating anything with regards to resident to resident and so on and so forth. So yeah, it's really important to pay our people right, to fund resident services the right way. I know that a lot of funding for resident services comes from grants that come with a lot of stipulations and a lot of ways that restrictions around being able to use. And so it would help. It has helped immensely that the organization is willing to fund it out of its own core budget, so that there aren't like tons of restrictions, at least for part of the budget. So yeah, funding for our people and taking care of our people.
Thanks so much, Bunthay. We're going to transition. Natasha, you went, right? Yeah, everyone has gone except Mary Pat. Yeah, okay, just making sure I'm tracking. So Mary Pat, from a public health perspective, as a nurse, how do you see the impacts of the challenges mentioned today on the humanity of those serving in the resident services coordinator role?
Thank you, Danny. So caring for the adults, the different ages in senior housing is what these amazing resident services coordinators do day in and day out. As you heard from the panelists, the needs of the residents are increasing. This is not just medical complexity, as many residents are aging in place. Formerly, they may have gone to a nursing home or assisted living, but they're now aging in place, and they're also living with and being faced with challenges of behavioral health and mental health issues. You've heard about compassion fatigue, perhaps. This is a term that describes the physical, emotional, and psychological impact of helping others, often through experiences of stress or trauma. Though compassion fatigue is often seen in first responders, law enforcement officers, and at-home caregivers, we actually see this occurring in our resident service coordinators. This is not the same as burnout, though burnout is a factor too. Many resident service coordinators have faced their own personal trauma, and then they're being exposed to secondary trauma in their day-to-day work. We must pay attention to and support these frontline workers through care, advocacy, training, support, and primarily the need to address safety issues. It's not acceptable to say, well, it's all a part of the work when a person is threatened, assaulted, or faces racism. Truly listening requires a commitment from the community to focus on fair wages, accessible housing for resident service coordinators too, training and support. Public health and wellness are not only important for residents in our communities, but for the resident services coordinators and resident services managers as well. Thank you.
Wow, Mary Pat. Thank you for so succinctly identifying so many of the issues that we're all, as a community, the resident service community is struggling with. Appreciating your feedback and your wisdom. All right, panelists, third and last question for you. What would you like the audience to know about this work? And what do you feel you could benefit, or what do you feel you need from them? And we'll start with V.
Thank you. Like I shared earlier about the innovation grant that we fortunately to receive, but unfortunately, site is only due for King County, and it will only an innovation grant. So we have a deadline to complete without a sustainable plan to continue the work. We hope by the end of this innovation grant, we're able to complete a playbook so that we can share with other affordable housing peers who are working like us to see if they can utilize that innovation plan to support the resident on site. So for me, I would love to have more resources, either funding or resources of training to support the resident staff, not only in King County, but all counties, because I know we usually have more resources in King County, but because we are serving residents from Bellingham to Vancouver, so we would love to have more resources so that we can support all the staff, not only in one county, but all county, because that will support all the residents that we are serving. Thank you.
Thank you, V. Kellie.
Okay, so I want to talk a little bit about money, but I want to talk about it in a little bit of a different way. So for the communities that my agency serves, we serve the tax credit communities that are usually private investments by corporations or private individuals. And so I want to talk about that funding for resident services coordination should be an integral piece of the development of that community in such a way that you would consider it no different than the plumbing or the electrical, and that it's funded in such a way that it's considered throughout the lifetime of the community as an interwoven piece of the infrastructure that's needed to maintain that community. So for example, when you have a community, let's say you have a tax credit community that you know you're going to have for 20 years, the idea that resident services coordination brings you the ability for folks to be able to age in place means that as people age, their needs are going to be greater, which means that your funding for resident services coordination should also increase as the community ages. Just like you're going to need to be able to update the plumbing or the elevators or whatever, after a certain number of years, and to build that funding into that intentionally. The other thought I had was one of the biggest problems we have is that there is no architecturally designed office space for our community, for our resident services coordinators. And so often they're doing this really difficult personal work in community spaces, which is really uncomfortable for both the residents and the resident services coordinators. So if there's any architects out there, could you please include an office for resident services coordination in the design of the building? And then kind of to piggyback on what Bunthay was saying earlier, when you're at the development phase of a new community, listen to the residents that you're going to be serving. They should have a voice. They should be they should be on your board or have a part of your design committee and be a part of that from the very beginning, because it's sort of this idea that you're doing something for somebody without any of their voice not being heard about what they would actually appreciate you to be doing for them. So kind of thinking about it through that lens, not for us, without us. I also have so many other great policy ideas. Clearly, I'm not a policy person, but But yeah, I just think listening to the people that are on the front lines and listening to the people that we serve in the context of developing the communities, I think would really change things in a lot of ways. Yeah, so I'll stop there because I could go on for hours. No one wants that, so.
You've made great points, Kellie. Thanks. We appreciate you very much. You have a lot of wisdom. I'm going to transition to Bunthay.
Yeah, I think what folks could do, one of the most impactful things that folks could do to support what we do is support the Seattle Housing Levy. As you know, there's like this new proposed levy has a resident services carve out, I think, for funding at 26 million, which is roughly almost 4 million per year. And this would go a long way in helping organizations that serve in resident services, as far at least for organizations that serve communities in Seattle. And so that's a huge chunk of money that is sorely needed in the resident services world, right? And the way that you can get involved in that, I know that there's a May 31st public hearing, public comment, and the best way to keep up to date with that is, if you aren't already subscribed to it, is the HTC Weekly Digest. There's great information on there, so that you are in the know of things, and you can kind of make your own decision around how to engage that further. But at least at the very basic level, that has information on how to keep that top of mind, and also engage in the different ways, because I know different folks can show up differently. And so you know, these public comments in meetings are super important, because the folks with power love to hear the stories that come out of our community, right? And so what how can you show up? How can you show up to support a segment of the industry that you know, isn't funded the right way? And this is one way you can do that. Support the housing levy, show up for public comment. HCC has a great campaign behind this, and so tap in, subscribe at least to the Weekly Digest, and then go from there.
Thank you, Bunthay. Thank you for the very clear, direct, fairly easy ask of our community. Natasha.
I echo what everyone else has said, and just having really clear expectations of a resident services role. If we expect them to solve all these problems, we need to pay them. If we want educated and trained people, we need to pay for that. And also, we need to pay the resources. So we need more support and crisis response in the emergency service patrol expansion. Even the food banks need more donations. So we could start there by supporting. If we're going to offer resources to residents in our communities who are struggling, we need the resources to actually be able to help them. So I agree with what everyone else has said, and I'll just add that to support the resources.
Thank you, Natasha. Mary Pat, do you want to wrap this one up?
Thank you, Danny. So many of you have heard me say affordable housing means appropriate housing. Not everyone is going to do well in a 200-unit building, and not everyone is going to do well in a tiny home. And that also includes resident service coordinators thinking about their specific needs. As a community, it is essential that we have housing options as well as housing support. Building is more than just, quote, brick and mortar, as you've heard. It's having housing support staff that will help with housing stability, and also the needs of the housing providers, including a space for meeting with the residents, bringing services to the housing building when appropriate for the residents, like fall prevention services, the senior drug education program. What are the services that are needed by the residents? And bringing training for our resident service coordinators, offering them a living wage, offering accessible housing and security to our resident service coordinators is key for housing stabilization and for supporting the incredible work that the resident service coordinators do day in and day out. Thank you.
Thank you so much, Mary Pat. Your passion in service to the resident service coordinators and all of those who are supporting residents is palpable. We're so grateful to have you in our community and supporting us. Thank you. I have questions from the audience. So those were our questions to the panelists. I have a few questions from the audience. Are you all game for those? All right. I got one nod. I got a couple nods. Okay, here we go. I have a question from Jamie. What is the typical staff to resident ratio?
I can answer that question. I think it depending on the housing providers, because each of us, like you heard, do resident service differently. But I can share what Mercy Housing Northwest doing. For example, at a property in King County, in South King County that we have with 150 units, we're serving about 550 residents, including children, adults, seniors, in different and a very diverse community. We have only 1.5 staff as a resident services there, 1 full-time staff and 1 part-time staff. So, and it's similar across our region.
I'll jump in. So at CIRC, we do it a little differently in that our resident services side of our agency we're split into 3 different kind of categories. One is resident services coordination, one is programming, and then one is transportation. And so our resident services coordinators are the ones that kind of do the deep dive one-on-one support of residents. And then our program managers do sort of the global programming across the portfolio. And then transportation is kind of self-explanatory. They do the transportation piece. Our resident services coordinators for our senior communities are probably 1 to 350 residents. So our resident services coordinators are usually serving 2 to 3 communities each. So that's kind of what we look like, keeping in mind that the programming is happening by other folks. So.
We have ours by household. So I think we try to keep under 250 households per resident services coordinator. I think we're around 200 to 230 right now households. That's where we're at.
We can be stretched pretty thin, anywhere from 300 something to 800 something units per resident services coordinator. We've also taken on the HCV program. So that's the housing choice voucher, what you might know as Section 8. And so, I mean, I think we have 14,000 vouchers out right now. That doesn't mean that the RSC works with each of those people. So what happens kind of with that position is you're kind of brought in at the end when someone is about to be evicted or terminated from the program. But that's a really interesting and great program, and we're expanding that. So yeah, but for the public housing sites, it's for, I would say I'll do 300 something to 800 something at the max.
Thanks, Natasha. All right, next question. Unless Mary Pat, you wanted to weigh in at any point on this? Okay.
No, I don't have anything to add. Thanks.
Thank you. Next question is from Kellie. How can tenant and community advocacy help to secure this training, funding, and workforce housing?
Okay, I'll go from a policy level. Again, I'm coming from an agency that does tax credit properties, which is different than HUD funded properties. And I honestly think that these types of things need to be included at the top level. So as a part of the tax credit process or expectations, these types of things need to be included there so that the ownership groups aren't able to sort of try to throw it off in other ways, or ask that the nonprofits that they're partnering with figure out the funding. So I kind of feel like it should be at that very top end, and that it should be very clear about the percentage, or somehow like the amount of funding that needs to happen at each level as the community ages. It's kind of where I'm at. So I guess I'm trying to say the policy needs to come at the highest level, and the expectation is that it's going to happen, and there's no way of sort of sloughing that off onto your nonprofit partners.
Thank you, Kellie. Do others want to weigh in on it, on this question from Kellie?
I think a real quick answer is show up for the levy. Somebody dropped in a link, and through that link, you can either become a testifier or an endorser. So mobilize your people. I think here at my bigger housing associations, we're thinking, or at least I'm thinking about ways to, what does it look like to mobilize some of our residents to also come and testify. So whatever that means to support the levy is one way.
So the next public comment is May 31st. So hopefully you and your coworkers, your partners, anyone that you know can come and support the housing levy.
Thanks, V. Thanks, Natasha. Mary Pat.
Thank you, Denny, and all. So I would also say it's so important for everyone to have as much transparency and clarity as possible. I know some of the things historically Natasha can share too from all these years of being involved in resident affinity group, that things have changed over time regarding evictions, timeliness of paying rent and things like that. And there can be a lot of internal stress and strife amongst the tenants, residents, saying, why do you allow XYZ to go on and why can't this be done? And one of the things is that we found that it's really important for the residents to be grounded. What is acceptable behavior? We have residents that have aged in place that have lived in housing for 20 years. They consider it their home. It's not just a rental, it's their home. Where other people that are just moving in, they're thinking it's just 4 walls. So really understanding and clarifying to the community of all the residents that are living in the buildings to understand the importance of the rights of the tenants, residents, as well as the responsibilities. There's always has to be that balance, and that includes the safety of the resident service coordinators and managers as well. There's rights and responsibilities. Thank you.
Thank you all. Any additional input? Okay. Thank you all. Next question comes from Scott. Do resident service workers perceive any relationship between their work and physical design of the building? Are there spaces, spatial layouts that make your work less challenging? Are resident service coordinators involved or participate in building design from the very start of the design?
You've asked a controversial question.
Perfect. Let's dig in, Natasha. And I know
You've asked a controversial question. So this is one where we actually have a resident services safety committee at King County Housing Authority, and it's been helpful. I recommend that for the other agencies too, just a time to get together and talk about safety, like your physical safety on the site, including your office layout. So we're not that it's perfect and not that we get everything we want, but it's helpful because at least we're sending a consistent message of what's needed. So no, we're not typically considered in that. Some of our staff, you know, their office is actually a formal puzzle closet with no windows, and you can't have a resident inside your office with you because it's unsafe. It was unsafe before the pandemic, but then after, we're still doing social distancing and that sort of thing. Sometimes it's hard to do the layout correctly so that you can escape when needed. So, if you've ever looked into any of that, which I'm sure most people have, you have to have an escape route with someone in your office. You have to be able to get out. So if the desk is in the way, or you have to sort of crawl around someone to get out, we talk about stuff like that at the safety committee. And sometimes there's just no room for that. We can, it was brought up before, we can meet with people in the community room. That is not ideal for the sort of conversations that we have with folks. They don't need their neighbors to hear everything that they're talking about. I wouldn't if I were them. But sometimes that is our only choice. And several of our properties, there just isn't office space for us at all. It's obviously going to property management first, since they do have to manage the property. And then sometimes we just do home visits or meet in a conference or meet in a community room, I mean.
Yeah, I want to jump in on this one too. It is actually quite rare where there is office space in the community. So we serve like 45 communities, and out of those 45 communities, there's office space in maybe 8 of them. And so what that does is kind of force you to do the work in the community rooms, and or do home visits. And home visits are fine when they're fine when they're fine, and they're not okay when they're like not okay. And you also have to take into consideration, sometimes we're going into people's homes who have pest infestations. And so then you're putting the RSC at risk for coming home with bed bugs and or lice and things like that. So it's more than just like kind of worried that a resident might be getting out of control themselves. There's a lot more things to think about. Whenever I go to meetings that have like the developers at them, I always say it very loudly and clearly to please create office space for your resident services coordination. I think it needs to be an integral part of the development of the community. The other thing I want to say is many of the communities do not even allow resident services staff to park on site. So for folks that do drive, they have to find parking somewhere else, and down the road or wherever, which also increases their sense of not feeling safe when they're leaving or when they're walking to and from the community. So being intentional about adding parking for resident services staff would also be hugely helpful in development of these communities. Thank you. And I don't ever recall being invited to a meeting on design and construction, but I'd love to go.
At Mercy Housing, we did a little bit different, because most of our property that have resident services have community room, and we are invited to the meeting with the developers at the beginning, to start design the building, because they really listening to our resident service team and learning from any feedback, either good or bad. For example, during COVID, we do a lot of shifting in food supporting, very different than before the pandemic. So we told them we need a space for the food pantry beside the community space. We need commercial fridge, we need commercial freezer, so that in the development in the future, they would be able to design a space for us so that we can keep the food on site. And the same with Kellie, we need more parking so that staff feel more safe because right now in Seattle, I know we set aside the space for more unit, but we also need parking so that staff feel safe, especially our staff working late night shift. They're not going home until 7 when everybody else going home. So having a parking nearby or inside the building would be very beneficial for our staff.
Yeah, second, the need for space. And again, we're a smaller organization. We have 8 properties. We only have really two of the properties that have like office space where folks can have a space to share and not risk being heard by other people or the property manager. And so we definitely would be great to be brought into these really foundational meetings around development. And so we as an organization have just begun that ourselves. We don't have a long history of that. And so we hope that this like us being brought into these things can like impact all these things like that Kellie, Natasha had said around like the need for space, and also just thinking about the end user, right? Like as somebody said earlier, like we build these buildings for somebody that is never brought in to have a say in it. And so that needs to change. And so having a voice right in from jump is important, and also out of that, meaningful spaces for us to engage with our residents.
Thank you all. There was a question earlier about the ratio. We were talking about ratios of staff to residents, and Shali, thank you so much for responding with a link to that. I think 50 to 100 residents per resident service coordinator is what's recommended. And then Carrie asked a follow-up question, which I thought was really helpful for us to think about. And perhaps those of you who know of folks who have a ratio that seems like it may be more in line with that 1 to 100 ratio. Carrie asks, we hear a lot about cost per unit when building new housing. What would be the budget per unit for that more ideal ratio of 1 to 50 or 1 to 100? How can we better decrease materials and labor building costs so that there is more set aside for human capital? I don't know if any of you have the answer to this question, or if there are perhaps any audience members who could speak to this question, but I'll throw it to the panel first.
So our agency, we did a deep dive in looking at what the cost per, sort of like what the monthly cost per unit would be for resident services coordination if it was funded at the best levels. And there's some research that hasn't been published yet, and then some that was just recently published in Seattle. So it was really comparing apples to apples, and it was basically I hope I'm saying the right number, but I feel like it was basically like $34 per unit per month would fund resident services coordination at the what's considered the best practice rate. And that was in Seattle. And I could try to find that research. I don't actually remember off the top of my head where it came from, but I could try to find it.
Yeah, Kellie, if you would, I think it's a really, really good question.
Yeah.
Appreciate you. Thank you.
And then just to add, maybe collectively, we should value the people who are doing the resident services as much as we value the building materials.
Thank you, Natasha. What's the expression you use, Mary Pat, about staff? You're muted, my friend.
Okay, in relation to what?
The importance of staff. You have like a little It's a little
I have
saying
so
of
many Mary Pat-isms. One is you can't give what you don't have.
yeah.
I have another one that says, if everyone can do it, everyone would be doing it. So, I mean, you can see the uniqueness of the individuals on the panel and the incredible gifts that they're bringing. But obviously this work isn't for everyone. So we really need to lift the folks up that are doing the work and continue to support them.
Yeah, obviously we can't do this work without resident service coordinators and staff who are supporting the residents, right? I think there was one last question. Oh, I think it was Cricket. Is there anyone who's working on a project to address hoarding that you all know of?
I usually refer people to Cricket, so so no, I don't know of anyone.
Okay.
That is a very high need. We know that that's gotten worse during the pandemic too. So just to add that, so if we want to really, really fund Full Life and other programs like that, that can give ongoing support, that would be great.
Okay. We have a few more minutes, and this is a big question. So I'm going to ask only a few of you to respond. And the question is, how has resident service coordination changed in the last 5 years? Kelly, are you talking?
I was saying this should be a Natasha question.
Great. Let's put Natasha on the spot.
So how is it? Well, the pandemic has changed things, right? So residents have been isolated. We have been isolated and not had our same communities. We have struggled with our own mental health and our own just drive and desire to get the work done when feeling hopeless in every other way. Residents have been isolated. They haven't had their inspections or legal notices or rent payments. Moratorium stopped that too. And it sort of just exacerbated the issue that they were already having, the barriers that they were already having of not being able to pay rent and not being able to adequately handle their mental health issues or substance use disorder. So like I said before, when I first started this work, it was more just giving a family a rent resource. Oh, call this number and this agency can help you. Okay. Or this is where the food bank is and these are the days that you should go, and you know, what else would you like in our community, after school programming, that sort of thing. Whereas now most referrals that we get are for a mental health issue or a substance use disorder issue. Does the referral say, oh, this is a mental health issue? No, but it's the late rent, the lease violations, it all comes back to mental health issues. And the problem that's sort of the other problem that's increased is the will to get help from residents, I see has greatly declined. If you look at their lives over the past couple of years, they haven't really had the legal notices, or they didn't have to pay their rent, or they didn't have to address these sort of issues that have put them in the place where they are. So now that we're coming out of that, and now everybody owes a ton of money and their apartment is, you know, hoarded, full of items that weren't there before when they were able to keep up with it. Now they're asked to address all of this and fix it right away, now that inspections are back on. And what is fixing it? I mean, fixing means getting Natasha, getting V, getting Kellie, getting Bunthay in there to like fix it for them, right? That's not how this works. That isn't going to fix anything. So it took 5 years to get here, 3 years to get here. It'll take much more than that to get back out. So I think it's mostly just due to isolation. And also bringing in people who have higher barriers. And like I've said before, we need to be doing that. We need to help the folks with higher barriers. We just need the infrastructure, the skills, the training, the staff with the skills and experience to deal with that, and all of that costs money. So that's my 2 cents.
Thank you, Natasha. Mary Pat.
Yes, thank you, Natasha. And again, I go back to that sense of balance, rights and responsibilities. I visited with an older adult in a senior building in Ballard, and she said, "Can I talk to you privately?" And I knew many of the residents in this low-income housing building, and she said, "I'm struggling. My neighbor is smoking in his unit, and I don't want to cause problems, but I don't know what to do." So we talked through it, and I said, on the one hand, I know you don't want to report the individual, but on the other hand, look at the severity. Should this person who you already reported has had some small fires, have a complete unit start on fire, a lot of residents are displaced. And I think this is some of the human challenges that the resident service coordinators are facing, as well as the rent payment and the hoarding and things like this. What is happening if a person is not compliant or adhering to the rules and brings in furniture from the outside that has bed bugs or something? Now you have infestation for the whole building. What if somebody is smoking? What if somebody is doing in one of the senior buildings in Green Lake, they had a kind of a fire or an explosion many years ago where the windows completely blew out. Safety for everyone is really imperative. Safety for all the residents that are living there, as well as the safety for the resident service coordinators, property management, maintenance folks. As you said, Natasha, being able to do these repairs, you have to be able to go in and safely be able to do the work. Thank you.
Thank you. I think some of the things that I've also heard among you all in the resident service coordinators through the resident service affinity group are the challenges that they're experiencing now with, acute mental health and drug abuse, among other issues, is the challenge around, their roles and the responsibilities of their roles increasing significantly to the point when we're talking about safety, we've got staff picking up feces and needles and things like that. So we've got safety issues and maintenance issues, as you addressed, Mary Pat. I also have heard the request for, given that things have changed so much in this last 5 years, the request for additional support that looks like perhaps clinical consultations or a service where staff members can speak to a professional for support, either for themselves or, again, for clinical consultation. So we're finding that because the needs are so acute at this point, folks are struggling as they go home with the burdens of what they're experiencing day to day, whether they've been physically accosted, emotionally or verbally accosted, having to pick up human waste, deaths at the sites, fires, people being displaced. The needs for the residents and now the staff are at this inflection that I spoke of earlier. It's just not sustainable. So on that bright note, I want to thank all of you for being here. I really appreciate the panel. I want to acknowledge all the resident service staff who have been very vulnerable and open and sharing of their emotional labor and time in giving us feedback. I really want to thank the community that's here today. Many of you dropped links in the chats for support. We are trying to figure this out. There are no clear solutions. Of course, funding is super helpful, as we know, and folks showing up to testify and to endorse the Seattle levy, the Shizzle levy, the Veterans Services Human. I don't have all the initials right, but I think everyone knows what I'm talking about, the Veterans levy. And really just grateful. I dropped a link in the chat to folks to be able to check out other sessions this week that's being offered through HDC. Again, a thank you to our sponsors, and my email is in the chat for those who would like to receive compiled feedback that we have to date. We're still collecting feedback and digesting information in real time from the resident services community, and really want to give a shout out to the resident service community for all that you do. And every single day we support you. You are appreciated, and we know we couldn't do this work in support of the residents without you. With that, wishing everyone a really good day. Thank you.